Here we go.
Going to show you how to scan the acromioclavicular joint and the subacromial bursa. So we'll start with the AC joint. So first thing we'll do is we'll take two fingers and place them on the posterior aspect of the AC joint, or the posterior aspect of the clavicle. The probe then drops onto those fingers, and what we see on one side of the screen is the clavicle, and on the other side of the screen, the acromion. The movements are just slightly posterior and anterior, just to make sure you take in the full depth of the acromioclavicular joint, and then some slight angulations to make sure the bones are nice and bright. The area of interest is going to be the edges of the bones to see if there's arthritic changes, and also the center to see if there's an effusion in the AC joint. So that's how we scan for the acromioclavicular joint.
Great, let's move on to what we see. So first thing we see is bone. So I'm going to draw that in this sort of white color. So there's the acromion and there's the distal clavicle. Now we know they come down to about here, but you can't really see the deep aspect of them on ultrasound at all. Now what's lining bones? Well, we know that articular cartilage is lining bones. We can't really see it all that well. Fluid, well, we know between bones is joint fluid, so we're going to color that in. Ligaments, well, what we see here is this ligament on top, and so that's the capsular ligament. And down the bottom, can't really see it, but we know at the bottom is going to be a capsular ligament there as well. Tendon, well, we can't really see any tendon in view here. However, we know over on that side, over here is going to be the tendon of the deltoid muscle, and we can't see any muscle on here, but we know our deltoid muscle is going to be over here. So we'll clear that away and draw it one more time real quickly. Bone, bone, cartilage, we can't see it, but we know it's lining this, okay? Joint fluid, ligament, tendon, we can't see it, so we'll omit it. Okay, now it's time to move on to the next video.
I'm now going to show you how to do an acromioclavicular joint injection. The position of the patient is supine with the palm facing up. Your landmark is the distal clavicle. I'm going to take my ring finger of my probe hand and place it on the posterior aspect of the distal clavicle. My probe then falls against that ring finger right at the end of the distal clavicle.
And we can see the distal clavicle on the right and the acromion on the left.
I'll bring that into the center view. The angle for the injection is going to be from anterior to posterior. I'll demonstrate that now. To do the injection, you want to get it between the two bones, about halfway down on the field of view of the screen right now.
Hey, congrats on finishing that section. Can I show you inside one of our live courses? Let's go.
I certainly can say that Frank's courses are very well structured, very well taught, very practical.
Just even being able to use ultrasound in like the top 25 conditions are the ones that we see in clinic.
There's a huge community and a huge well of knowledge when you join one of the courses and you have access to all of these people who have seen a lot more than you have, and there's no guesswork. You leave feeling very confident with what you need to do to be successful for your patients and then in your practice.
You want to be able to do basic hip injections, shoulder injections, elbow injections, and I think Frank Johnson set up a very good protocol and a very good syllabus to be able to get the top type of procedures you're going to be doing in clinic and make sure you understand those well before moving on to the next step.
My revenue went up almost instantly. There's always now just more opportunity to reinvest into my clinic, reinvest into the things that I like, and I've been very satisfied.